Hi everyone, how are you? Welcome to our dementia topic week. So I just wanted to drop in and give a little bit of knowledge this week. I'm going to be discussing the link between dementia and stroke or brain injury, since this is a question that I've gotten a lot from patients, from clinicians and family members and everyone. So in this next little video, what I'm going to do is discuss whether there's a link between stroke and brain injury and dementia, discuss why that link exists, talk about the people who are most at risk for developing dementia post-stroke, talk a little bit about how we can reduce those risks and make people a little bit, make them less likely to develop dementia if they have had a stroke or brain injury, and essentially why we want to know about this as clinicians. So right, let's get into it. So firstly, there is a very definite correlation between stroke and brain injury and dementia. People who have had a stroke are twofold more likely to develop dementia than those in the general population who have not suffered a stroke or a brain injury. And if we kind of think about a little bit why that might be the case, let's look at some of the forms of dementia and get into it that way. Alzheimer's disease, this is the most common form of dementia. It affects about, in those who have dementia, this is about 60 to 80% of people. And the most widely accepted reason for Alzheimer's disease is proteins, abnormal proteins and peptides that are in the brain. So let's have a little think about that, like why would that happen? There is some fairly compelling research out there that talks about the blood-brain barrier. So if you've heard of the blood-brain barrier, give me a hell yeah in the comments. The blood-brain barrier is a membrane that separates, keeps the brain apart from the bloodstream in layman's terms, and it keeps things that we don't really want in the brain matter out. So like larger proteins, things that aren't lipid soluble, things like that. If there's an interruption to the blood-brain barrier, if there's an injury of some sort, this will compromise that barrier and it'll be less able to function. So an injury that may happen from traumatic brain injury, like that could happen and interrupt the blood-brain barrier, and we have problems then. Or the blood-brain barrier can be compromised with advancing age, which we know is the #1 risk factor for Alzheimer's dementia. So then let's think about vascular dementia. The main cause of vascular dementia is multiple strokes. Vascular dementia is that stepwise dementia that has a just decline in physical and cognition over time. If someone has had a stroke and they haven't been able to recover fully, and then they have another stroke, and again, they're going to have that decline that we call vascular dementia, where essentially they're never getting back up to where they were. The brain isn't getting a proper chance, and you can see the relationship there. So that lack of oxygen in the brain, those areas that are affected by the strokes, then lead to what we call vascular dementia. So as we can see, there is that correlation, there is that risk factor. How many people are going to get dementia who've had a stroke? So over the 30 years between someone having a stroke or brain injury, over the course of 30 years, someone is, the risk factor, the percentage, the incidence of people who are going to get strokes is 12%. Compared to the population. So it's not a insignificant risk, 12% is pretty significant. And I think if you told someone who had a stroke that they may have dementia, they'd be fairly motivated to do something about it. But what can we do? So this is again where we as clinicians have a great opportunity to intervene. The things that can be done to reduce your risk factors of developing dementia post-stroke or brain injury are fairly straightforward. Physical activity is #1, the oxygenation to the brain. Eating more healthfully, avoiding processed foods or overly fatty foods can be very helpful, especially including vitamin K or omega-3s in your diet. That's going to help reducing your dementia risk as well as challenging yourself cognitively. Like the very process of learning builds those neuronal pathways that can help you offset some of the risk of developing dementia. And things like meditation, which has been shown to increase grey matter in the brain, can also be helpful. As clinicians, though, what we should be thinking is what caused this stroke or brain injury in the first place, because we have a really great opportunity to get in there and make sure that whatever is causing this issue isn't going to happen again. Like, does your patient not understand their medication and their blood pressure went too high and they had a stroke? Or is their balance wonky and then they're walking around the house giving themselves multiple concussions? That's going to cause problems too. Research is showing more and more that people who have hemorrhagic strokes, so the type of strokes that are a bleed in the brain, are going to be more likely to develop dementia. People who have a stroke at a younger age or brain injury at a younger age are going to be more likely to develop dementia. And there's a substantial amount of evidence that shows that people are going to develop dementia within 1 year of having their injury, and that the percentage of that goes down after 1 year. So again, when we're seeing these patients post-stroke or brain injury in the clinic, it's clearly within the year, we have a really important opportunity to get in there, educate them, tell them this is what you can do, tell them that this is a risk factor. Because I think, all of us as clinicians or, people that we care about in our lives, we want to tell them that we're not just focused on the problem in front of us, we're not just focused on fixing your ADLs or whatever, but we want like an overall better quality of life, which can include ADLs. But, a quality of life that will last, and we want to reduce your risk factors for more strokes or brain injuries or dementia, which is a real risk factor after you've had a stroke or brain injury. So, yes, that's just me dropping in and kind of busting that myth today. If you learned anything from this live, or if there's anything more you want to hear about, give me a thing in the thing below. I've linked to an article I wrote recently which talks about family conflict and why there's so much more family conflict with people, caregivers of dementia, than there is in like other conditions. So give that a read, and I will drop in for more waffle tomorrow. Thanks for listening. Bye.